One of the important aspirational goals for newly diagnosed multiple myeloma over the past several years has been to improve the depth of response and get patients to MRD negativity and help them sustain that MRD negativity. There are plethora of studies that have demonstrated that MRD negativity correlates with better PFS and overall survival using different assays. And this has been now tested in several clinical trials in the newly diagnosed setting, which incorporate Daratumumab into the schema of treatment. What we're learning is adding Daratumumab to the existing platform of myeloma therapies is improving depth of response and also progression-free survival. And in the case of at least one clinical trial, Alcyone, survival benefit as well, although that trial has its own critique and issues. So I think overall, if you look at the bigger picture, the advantage of this anti-CD38 antibody moving into the frontline setting is there doesn't appear to be a lot of overlapping toxicities with other therapies. The infection rates appear to be higher, but don't appear to be impacting the survival outcomes for patients. And we're just learning how to better use this drug and manage our patients. The subcutaneous formulation of Daratumumab has certainly gone a long way in making this a more convenient option for patients. We also saw updates in the relapse space with Daratumumab combinations. So the Apollo trial that looked at subQ Daratumumab with Pomdex compared to Pomdex, and then the CANDOR trial was updated looking at Daratumumab in combination with Carfilzomib Dex compared to Carfilzomib Dexamethasone. So, all of these options appear to show the same message. Adding Daratumumab makes the regimen better. Isatuximab, which is the other anti-CD38 antibody, appears to be replicating all of these, combinations as well. So we saw the IKEMA study and the ICARIA study that were presented last year and this year, respectively, looking at the Isatuximab combination with Pomdex and then Carfilzomib Dexamethasone, showing the same message that PFS is better when you add this antibody, anti-CD38 directed antibody, to those doublets. In terms of whether you can rescue a patient if Daratumumab doesn't work for a patient with Isatuximab and vice versa in combination with therapies, we just don't know the answer to that question. My personal impression is that they're kind of about the same in terms of efficacy and activity. It's just that Daratumumab got out of the gates first.